Hello, this is Keys to Diabetes. What comes to mind first about diabetes is sugar. Diabetes develops when there is a rise in blood sugar, and if not controlled, it could cause complications. Today we will show you a day in a life of a patient with type 2 diabetes. Please keep watching.
My name's Sarah. I have type 2 diabetes. I started getting really tired at work, more than normally tired. That's when I realised I should have diabetes test. My mum had diabetes, so I knew it was going to be hereditary, and I knew before the doctor told me that I had diabetes, and this was about 3 years ago. The diabetes didn't really affect any of my personal life, and even my social life. The only thing that you have to consider is if you're going out socialising and maybe drinking, that you have to choose the lower sugar option. So like a diet tonic with your gin, or a diet Coke with your vodka. So you have to choose. It's always there. You're always thinking about it. So it hasn't really impacted on my life personally or socially. Diet-wise, I don't eat breakfast. I should eat breakfast. I don't eat breakfast. Lunch, I tend to have a sandwich, which isn't brilliant because you really should be low carb if you have type 2 diabetes. Your carbs should be completely cut out. But I do tend to have a sandwich. It's easy, it's quick, it's fit. The ideal dinner is vegetables, fish, chicken, but no potatoes or rice or pasta or anything on the side. I tend to, dinner-wise, because I'm at home, most of the time when I have dinner, it is the vegetables and it is the chicken, the fish, or if I'm really pushed for time, it's something that I can stick in the oven. In terms of exercise, I walk a lot. I walk to the bus stop to work, which is actually quite a walk because you have to go over a bridge, down a couple of roads. It's quite, not far, but you have to walk. I walk to the local supermarket, which is quite far as well. And in my job, I walk up and down. I'm thinking of joining the gym. We have one down the road, so it will be perfect. It's near, just don't know financially how much that is. So I have to find out how much that is. A gym would be perfect. That would get my diabetes well and truly under control. And my medication, I take 2 metformin in the morning, plus a glycoside, plus a ramipril, and then I take again in the evening 2 metformin, another glycoside, and at night I take a pravastatin. I have a dosette box, which is meant to make it easier, but because if I take them when I'm at work, sometimes it gives me a bit of a dodgy stomach, so I tend to not take my tablets. So I don't take my medication as often as I should, and I know that for a fact, that's not good. I should take it more often. I should take it often, but I don't take my medication at all. The GP will call you yearly for a diabetic review. My blood sugar, when it gets too high, I get extremely tired, extremely tired, and I know it's too high. To manage the diabetes better is to eat the vegetables, is to eat the chicken, is to eat the fish, is just completely cut out the carbs. Don't eat crisps, don't eat chocolate. Obviously, we're all human, and we do eat chocolate, and we do eat crisps, and we do have a blowout or a takeaway. But the majority of the time, you can't really do it, not after diabetes. I do smoke cigarettes. I don't do alcohol, I don't do drugs, I just smoke cigarettes. The doctor has told me many a time, you should give up. Everyone's told me it. Obviously, you know you should give up smoking. I would like to give up smoking, but I would find it so hard. So the hardest part is actually trying to keep it under control, trying to keep your blood sugar levels down into a healthy level. And there is not really a best part. There's no best part of having diabetes. There's nothing to celebrate about having diabetes. But the hard part is this medication and knowing what could happen.
Sarah is a typical diabetes patient, and as you have seen, she's not well adherent to her medication and also lifestyle changes. Part of our campaign has included educating Sarah about how to take care of her diabetes better and also prevent complications. Thank you for watching this video.